Good day, everyone. I am Angel Berting T Campus from BSN 1-2 of Isabela State University at Chaga Main Campus. For today's video, you will be joining me in performing a return demonstration on the assessment of the thorax and lungs of a patient. Prior to performing the procedure, be sure to first perform hand hygiene, such as hand washing, in order to avoid transferring of harmful microorganisms to your client, since we consider all fluids as contaminated. So second is to prepare the materials so we will be needing for the examination. So we have here a pair of gloves used for the protection, an examination gown or drape used by the patient later on. We also have here a stethoscope, a marker, and a metric ruler. So after that, we can now continue our assessment. The first thing we must do is to introduce ourselves to the client, identify our client, and ask how he wants to be addressed. So good day, sir. I am Angel Bertin Campus, your student nurse for today. So may I know what is your name and age, sir, to make sure that I am with the right patient?
I'm John Mark J. Del Monte,
Okay.
20 years old.
Okay. So your birthday, sir?
20, February 3, 2002.
So, sir, kindly check your information if that's correct. Okay, thank you, sir. By the way, sir, how do you prefer me to call you?
Just call me JM.
Okay, thank you, sir, JM. So, next is to explain the procedure to the patient or to the client to know how important and how significant the examination is to its health. Okay, so sir, I'll be explaining you the procedure that I will be going to do today. So I will be assessing your thorax and so as your lungs. And for this assessment, I will be needing to inspect, palpate, percuss, and auscultate your breath sounds and so as your lungs. Okay, sir. So do you have any question before I proceed to the assessment?
No.
Okay, sir. So if you do have any question later, you can ask me throughout the assessment. Okay, so then we will ask the client if the things that we are going to do is okay with him, and make sure or explain to him that all the data gathered will be confidential. So, sir, I will be doing a physical examination on you, on your thorax and lungs, which includes exposing some part of your body and me some touching part of your body. Would that be okay, sir?
It's okay.
Okay, sir. So, rest assured and don't worry that all the results and the findings in this assessment is just between you, me, and the attending physician that I will be referring you. Okay. So after that, we will now ask the client to wear the gown for easily access of the examination. So, sir, would you mind to change your clothes into this gown, sir?
Okay.
Okay. Thank you, sir. After that, we also need to provide privacy to the patient or the client by closing the doors and the curtains on the room. And because the door is already closed, I am going to just close the curtains here. Okay, so before we start, we must do a subjective assessment to the client for the following question. Okay, so Sir JM, I will just ask some questions before proceeding to the proper assessment. So for the current symptoms, sir, do you have any difficulty in breathing? Okay, no. So next, sir, how about in chest pain, sir? Do you feel any chest pain? Chest pain, okay, no. How about cough, sir? Do you have any cough?
No.
None. Okay, thank you, sir. Okay. Now for the past history, do you have a prior respiratory problem, sir?
No.
Okay, none. Okay. How about in the previous thoracic surgery, sir? Do you have any previous thoracic surgery?
None.
Okay. Biopsy, sir.
None.
Okay. How about allergies, sir? Do you have any treatment or medication used in your allergies? Okay, none. So how about in pulmonary test, sir? Did you have an X-ray, skin test, or immunization? Okay, none. Okay. So for the family history, sir, does your family have a lung disease history? Lung disease, none. Okay. So how about in the health problem, sir? Do you smoke
No.
or use tobacco? Okay, no. That's good to hear, sir. How about on the surroundings, sir? Do you have something that causes a barrier on your fresh air, such as a secondhand smoke, sir? What I mean is that do you have any family that smoke?
Yeah.
Yeah. Okay. Who is it, sir?
My uncle,
Uncle.
yeah.
Okay.
My grandfather,
Okay.
and my father.
Okay. Okay.
And also my kapitbahay.
Okay. Thank you, sir. Oh. Okay, sir. So does it affect your breathing, sir?
No.
No. Okay, that's good to hear. So so if that's the case, sir, do you have any prescribed medicine for your lungs?
No, no.
Okay, none. Okay. So that's good to hear again, sir. Okay, thank you, sir. So the patient will remain in sitting position most part of the assessment. So our first part of the assessment is the assessment on the posterior part of the thorax. So first we will let the client sit with arms at the side and stand behind him or her while breathing. Then inspect for the shape and the configuration of the chest wall and so as the position of the scapula. We will also be inspecting for the accessory muscle or the use of the accessory muscle so as the client's position, noting posture and ability to support weight. Okay, so sir, can you please okay, sit straight and your arms at the side. Okay, thank you, sir. Okay, put your arms at the side. Okay. So sir, can you try to breathe in? Breathe in, inhale, exhale. Okay. So inhale again, sir. Exhale. Okay. Again, sir. Inhale, exhale. Okay. Last, sir. Inhale. Okay. Exhale. Okay. Thank you, sir. Thank you. So now I will be palpating for the tenderness and the sensation with gloves fingers. So start towards to the midline at the level of the left scapula and move to left, from left to right, comparing finding bilaterally. So move symmetrically downward and out to cover the lateral position of the lungs at the bases. So also palpate for the crepitus and follow the correct sequence when palpating. Then palpate also for the surface characteristics such as dilution or masses with gloved hands. Okay. So sir, I will be palpating your posterior thorax for tenderness and sensation. So please allow me to first put on my gloves. So I am, or I will be able to be protected from any. Okay, so sir, I am done putting on my gloves. So I am going to palpate now your thorax for tenderness if there is any and to look your sensation and observe for any lesion. Okay, so I'll be palpating your back now, sir. Okay. So, okay. Okay. So sir, do you feel any pain?
No.
Okay. So sir, do you feel any pain?
No.
Okay. So do you feel any pain, sir?
Nothing.
Okay. How about this, sir?
No.
Okay. Okay, so do you feel pain, sir?
No.
Okay. How about this, sir?
No.
Okay. How about this, sir?
No.
Okay, that's good. So here, sir. Sir, do you feel any pain?
No.
Okay. So good, sir. Oh, so after that, I will be palpating your temperature, sir, using the dorsal part of my hand. So okay, sir, I will be palpating now. Okay. 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 Okay, that's good. So as for the scapula, sir, it is symmetrical and I have not seen any punctuation. And also for the shoulder and for the scapula, sir, it is equally horizontal or horizontal position and the posterior back of or your posterior back, sir. And also, I haven't seen any signs of kyphosis, scoliosis, and any disalignment of the spinal cord of the patient, which is a good sign. So, when I asked the patient to breathe, I observed that he uses his shoulder for the accessory muscle in breathing. So, or what I mean in breathing or inhaling and exhaling. So, within the temperature, it is equally bilateral as I observed and touches the patient's posterior back. So, Sorry. So I can say that it is warm and not too hot nor too cold. So the client or user hasn't feel anything when I palpate and observe it. So I can say that you hasn't feel any tenderness and there is no lesion available on your posterior part as I am inspecting it, sir, which means that is a good sign. So next is to palpate the fremitus using the ball or the ulnar edge of the one hand while the client say 99 and is to assess the symmetry and the intensity for the vibration. Okay, so sir, our next is to palpate the palpate your fremitus using my ulnar edge of my hand. So, sir, can you please say 99 as you feel, or can you please say 99 to me if I touch or if you feel my hand into your back, sir? Okay, so sir, can you please say 99? Okay, so sir, can you please say 99?
99.
Okay, sir.
99.
Okay, again, sir.
99.
Okay. Sir, say 99.
99.
Okay. Sir, not saying 99.
99.
Okay. Sir?
99.
Okay. Sir, say 99.
99.
Okay, last sir.
99.
Okay, that's good. So our next is that to palpitate for the expansion of the chest. So we will be placing the hands for the posterior chest wall with the thumb at the level of the T9 and the T10 and observe the movement of the thumb as the client takes a deep breath. Okay, so next sir is I will be palpating your chest expansion. And to be able to do that, sir, I will be placing my thumb at the T9 and T10 level of your posterior. So, sir, can you please inhale? Okay, sir, exhale. Okay, so please inhale again, sir. Okay, exhale. Sir, can you please inhale again? Okay, exhale. Okay, inhale. Okay, last. Last inhale, sir. Okay, exhale. Okay, thank you, sir. So, for the fremitus, I have observed that it is symmetrical, and I can see that the vibration when the patient say 99. So there is no presence or there is a presence of the vibration as I palpate it. So now with the percus tone or we will now percus for the tone. So we start at the apice of the scapula and the percus across the top of the both shoulder. So also percus the intercorsal spaces across and down, comparing sides and the lateral aspects at the base of the lungs and compared size. So, sir, allow me to percuss your lungs. So, sir, can I percuss?
Yeah.
Okay. So, sir. Okay. 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 So as I have observed the resonance and the dullness and the flatness as I percuss the lungs of the patient. So now I will be percussing the diaphragmatic excursion. So I will be asking the client to exhale forcefully and hold the breath. Beginning at the scapula 9 of T7. Okay, so here's the T7. Percuss the intercostal or intercostal spaces of the right posterior chest wall. So we will be percussing downward until the tone changes from resonance to dullness. Okay, so we will be marking the level and allow the client to breathe. Okay. So next is to ask the client to inhale deeply and hold it. So we will be percussing the intercostal spaces from the mark downwards until the resonant changes to the dullness. Okay, so we will be marking again the level of that resonant to dullness and allow the client to breathe in. So we will be measuring the distance between the two markers. Okay, so Sir JM, I will be percussing the diaphragmatic excursion. So I will be using the marker I have here and this metric ruler. So okay, sir, can you please inhale and exhale and hold? Okay. So sir, can you please inhale, exhale, hold. Okay. Okay, sir, you can breathe now. Okay. Okay. Now, sir, can you inhale and then hold? Okay. Sir, you can breathe in first. Okay. So now, sir, inhale, hold. Okay. Okay. So after that, we will be escalating for best sound, noting location. So and then we will gonna be escalating for the adventurous sound, so as the voice sound. So for the
Mamatay na.
bronchophony, wala, ba't nagsalita ka?
Hindi ka huminga.
Okay.
Hindi mo pinili. Ganun talaga yan.
Oo.
Mamatay na ako ah.
Hindi naman sinabi ito Is. Ulit. So now escalate for the breath sound, noting location. And so as escalating for the adventurous sound and the voice sound. So for the bronchophony, ask the client to repeat the phrase 99 while escalating the chest wall. Okay. So for the egophony, ask the client to repeat the word E or the letter E while listening over the chest. Okay. So I will be using this stethoscope to hear the vibration. Okay. Okay, so sir, can you please wait, sir? So sir, can you please inhale, sir? Again, sir, can you please inhale? Exhale. Okay. Inhale. Exhale. Okay. Okay, inhale. Exhale. Okay. Inhale. Exhale. Okay. Inhale. Exhale. Okay. Last inhale. Exhale. Okay. So after that, we will now be escalating for the bronchophony. So, sir, can you say 99 as soon as you felt my stethoscope? Okay. So, sir, can you say 99?
99.
Can you say 99, sir?
99.
Okay. Say 99.
99.
Okay. Sir, can you please say 99?
99.
Okay. Say 99, sir.
99.
Okay. Sir, can you please say 99?
99.
Okay. 99.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay. Say 99.
99.
Okay.
99.
Okay.
99.
Okay. Thank you, sir. So after that we will going to the egophony. So sir, can you please say letter E?
E.
E. Okay. Sir, say letter E.
E.
Okay.
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 E.
Okay. Thank you, sir. Okay. Okay. Thank you. So as I am escalating for the breath sound of the patient, I haven't observed any adventitious sound or any abnormal sound that is making or that has been made in this assessment. So I also haven't observed any crackles or any friction for a rub, which all in all gives us a good sign. Okay. So our second assessment is the assessment on the anterior part of the thorax. So first is to inspect the shape, the configuration to determine the ratio of the anterior posterior and diameter and to transverse diameter. Okay, so sir, can you lift up so I can see or look at the posterior? Okay. Okay. as I can see, the shape of the anterior posterior is good, and so as the configuration. So the transverse diameter to the anterior posterior diameter is 1:2 ratio, which is a normal ratio for a person. So now we will be inspecting the position of the sternum to the anterior and lateral viewpoint, sir. So so as the sternal erection, sir. So can you please lift up again, sir? So this is okay. Thank you, sir. So we will be also inspecting for the slope and ribs, sir, from the anterior and the lateral viewpoint. Okay, so can you lift up again, sir? Okay, so can you lift up? Okay. Okay, thank you, sir. Okay, so after that, we'll be inspecting for the quality and pattern of the respiration, noting breathing characters, rate, rhythm, and depth. And also, we'll be inspecting the intercostal spaces while client breathes normal. We will also be inspecting the accessory muscles. So, sir, can you please inhale? Okay, so exhale. Okay, inhale. Exhale. Okay, inhale. Exhale. Okay, so as I can see, the breathing characteristics, rhythm and depth are good, and the accessory muscles used for breathing is the chest in the anterior part. Okay, so we will be palpating the tenderness and the sensation using my finger. So, sir, can you please lift up so that I can palpate it? Okay. So, sir, do you feel any tenderness or pain? Okay. Sir, do you feel? Okay, that's good. Sir, do you feel? Okay. Do you feel, sir, anything? Okay. Sir, do you feel? Okay. Do you feel pain, sir? Do you feel pain, sir? Okay. Do you feel pain? Okay, that's good, sir. So as I am palpating my client, I observe and I can see that he cannot feel anything pain or tenderness, which is a good sign. And there is also no swelling onto the part of this anterior. So after that, we will be palpating for the tenderness and at the costochondral junction of the ribs, and also palpating for the creptus as you would, or as we have done on the posterior thorax. So we will be also palpating for the surface characteristics such as lesion masses using the finger of the gloved hands. Okay, so sir, we will be palpating your anterior thorax for tenderness and sensation. So, sir, can you please lift it up? Okay. So, I will be palpating it again, sir. Okay. 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 So, as for the scapula, it is symmetrical, and I have not seen any punctuation. And for the shoulder and the scapula, it is equally horizontal, positioned in the posterior or the anterior part of the patient. So when I ask also the patient to breathe, I observe that um, that his um, breathing are good and in the rhythm, and also he felt no pain while palpating, and observed that he cannot feel or didn't feel any tenderness. So there is also no lesions available or present on the anterior part of the patient. So it gives us a good sign. So now we will be palpating for the fremitus using the same technique that we have done as the sequence on the posterior thorax. Okay. So sir, next is to palpate for your fretless, and I will be using again my ulcer part of ulcer edge of my hand. So sir, you will be saying you will be again saying the word 99. Okay, sir. Okay. So, sir, can you please say 99?
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay. Say again, sir.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay. Thank you, sir. Okay. So then we will be palpating for the chest expansion by placing the hand on the anterolateral wall, which with the thumb along the costal margins and point toward the xiphoid process. So, sir, I will be observing the movement of the thumb as you takes a deep breath. Okay, so, sir, I will be palpating your chest expansion. And to be able to do it, I will be putting my thumb onto the anterolateral wall. Okay, so, sir, I will be asking you to breathe in and breathe out. Okay, sir. Okay. So, sir, kindly breathe in. Okay, breathe out, sir. Okay, breathe in again, sir. Okay, breathe it out. Okay, again, sir. Okay, sir. Okay. Again, sir. Last. Okay. Okay, that's good, sir. So, for the fremitus, I have observed that it is symmetrical and I can see the vibration as the patient say 99 throughout the assessment. So, there is a presence of vibration, which is good and good sign. So, next is to forecast for the tone above the clavicle. So, also with the intercostal spaces across and down, sir. Okay, so I will be escalating for breath sound, adventure sound, and the voice sound. Okay, so sir, can you please? I will be using this stethoscope, sir. Okay. Okay. So, sir, can you please whisper the word 1, 2, 3? Okay. So, okay, sir. Can you please 1, 2, 3?
1, 2, 3.
Okay. Sir.
1, 2, 3.
Okay.
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 1, 2, 3.
Okay. Thank you, sir. So as I am escalating the breath sound of my patient, I have observed or I haven't observed any adventurous sound or any strange sound or abnormal sound that he composes or made. So I haven't observed any crackles or any friction for a rub, which is all gives us a good sign. So after that, we will be validating and document our findings. So, sir, I will be noting for the inspection and observation that I have done with your posterior and anterior thorax. Okay, sir. So, as I can see that your breathings are all in good condition. And so as your lungs, okay, well, that's good, sir. So I will be taking note of that, sir, and I will be referring or giving this information and findings to the attending physician that I will be referring to you. Okay, sir. Okay. So, okay. So, sir, we are now done in our assessment of the posterior and the anterior part of your thorax and so as your lungs, sir. Thank you for your cooperation, sir, and make sure that all the findings gathered will only be confidential to you, to me, and to the attending physician. Okay, thank you, sir. God bless, sir.